This next lecture will be broken into two parts for the other bacteria. This first part will cover the spirochetes and the intercellular or non-culturable bacterial agents. First, we'll talk about the spirochetes. These organisms demonstrate a helical gram-negative bacilli type characteristic, and you can see an example at the bottom where they kind of have that corkscrew spiral shape. And these organisms are differentiated by the number of axil in the fibrils and the number of insertion disc. So basically how it spirals, the look to it as a spirochete. And it's based on the biochemical tests and metabolic features. The organisms that we will talk about will be Treponema pallidum. This is a causative agent of syphilis, Borrelia. These organisms cause Lyme disease and relapsing fever. And then Leptospiroia. This organism causes leptospirosis. Treponema pallidum is an organism that will cause infection by penetrating the mucosal membranes or entering through breaks in the skin. So this could be through pretty much any area of the body, including the genitals, anus, lips, rectum, vaginal, oral. And so with this infection, it does happen within 4 stages. And so with your primary stage, you're usually just going to have some sort of cutaneous type lesion or chancre. And so these lesions usually will appear within 3 weeks and disperse within about 4 to 12 weeks. And so after that point, without treatment, it could lead to secondary syphilis. And with this, you're going to have fever, weight loss, a widespread rash. And that rash can cause like rough red patches on the skin. And so this is actually an infectious state where you actually have a live organism within the body. And so you can see an example of the rash on the face there of this patient. And you can see those cutaneous lesions throughout that patient at the top image. And then next you move into an early latent period. And this is a subclinical phase where the organism is not dormant. And so this is usually less than a year or 2 years or less, somewhere in there. And then it can move to a late latent period. And so this is your 4th stage. And with this stage, the patients are asymptomatic. It's not an infectious stage, so they can't actually transmit the organism at this stage. And this stage can actually last the entire lifetime of the individual. And so with a tertiary stage, you can actually start having tissue destruction within the patient. So with this stage, it's also non-infectious. And you actually have granulomas that can form on the skin, subcutaneous tissue or deep tissue, or it can even penetrate to the bone. And within the tertiary stage, you can also have neurosyphilis, where it actually affects the patient neurologically and mentally. And then one of the other types of infections that can be found with syphilis would be congenital syphilis. And this is when the infection is actually spread to the infant in utero. And so the organism will actually can affect the baby, causing things like a rash, jaundice, hepatosplenomegaly, anemia. So it can cause issues to the infant if it is left undetected. So to diagnose this organism, it's best diagnosed using dark field microscopy. And so you could detect directly from the sample by doing an examination using different fluorescent antibody stains and looking at it under the dark field microscope. And here you can see an example where those spirochetes are visualized using the dark field microscopy. You can also do different automated type testing, nucleic acids or NAT testing, as well as PCR. And then it can also be diagnosed serodiagnostically. And so this would be doing some of the different kit tests as well as automated tests in which you're looking for things like the treponemal antibody. And so an example would be then where you take the blood and you're actually looking for the antibody to the actual organism. And then you also have the non-treponemal antibody test, where you're actually testing against the Regan antibodies that are produced. And that test is what's called your RPR test. And there's an example of that here at the bottom where you're mixing the patient's serum sample with the test media and you're looking for clumping and agglutination. And then you also have your automated tests where you're looking for those antibodies within that patient in an automated method. Borrelia species cause borreliosis or relapsing fever. And so with relapsing fever, you have things like the headache, fever, weakness, tired, and this can usually happen within 2 to 15 days after the actual infection. And so you have two types, loose-borne and tick-borne, and you have two different Borrelias that cause it, Borrelia recurrentis and Borrelia hermannsii. The one that you're most commonly associate with any sort of tick-borne illness would be Lyme's disease. And with Lyme disease, it's caused by Borrelia burgdorferi. And with this organism, it's transmitted through the hard tick, which is also referred to as the deer tick. And with this particular infection, you do get the bullseye type rash on the skin at the site of the infection. And then it can also progress, if it's left untreated, to arthritis or neurological disorders weeks to months after the infection. And so this is often referred to as the latent Lyme disease. And then it can also cause chronic arthritis, acrodermatitis, chronicia, atropicans, and then with this organism, once it's treated, depending on the phase of treatment or the phase of the disease progression, it can cause a Jarisk-Hexarmani reaction. This reaction is characterized by the actual destruction of the organism within the body, and so when that organism is actually destroyed through the treatment, then it will start to release various cytotoxins, and then those cytotoxins can actually cause an illness within the patient that will make the patient very sick just from the release of those toxins. Dark field microscopy is often used to help identify this organism, and you can actually visualize it using a Wharton Sterry silver stain. And so with that, you're looking at this organism to kind of fluoresce in that dark field microscopy, so you can see a really good image here of that spirochete. It can be cultivated on Kelly medium, but typically this organism is going to be identified just based on the different serodiagnostic testing, where you're actually looking for it in some sort of molecular type method or immunoblotting techniques. And so this would be all automated type techniques that would be used to identify this organism. Leptospirorea can be divided into the organism that causes human leptospirosis, as well as there's one that is found within the environment. And so what you're looking for with this organism as far as the infection is it's transmitted from animals, and so this organism will actually infect the animal, and then the humans become infected once they have direct contact to the animal or indirect contact with urine or blood from the animal. So you could have the animal's urine contaminate water supplies, and that's how the patient would become infected. And these organisms will actually enter through breaks in the skin, or they can enter in through the eye. And then this particular disease can range from very mild symptoms like fever to very severe organ dysfunction. And if it becomes a more severe form, it will actually become icteric, in which it will cause issues within the liver, and you will start seeing signs of that liver complication. So you can see here where this patient actually has the jaundice within the eyes, so you can see that yellow pigment color within the eye whites. To diagnose this organism, again, it's going to be done through automated methods with like DNA type testing for the organism, serodiagnostics, and PCR testing. Or the organism could be looked for under dark field microscopy, in which you're looking for the particular shape of those spirochetes. It could be cultivated using semi-solid media that's enriched with Fletcher or Stuart rabbit serum. And there are vaccines available for animals, but not people. Most of your anaerobes or normal flora of the human body, but with endogenous anaerobes, these are usually going to cause infections from the body sites in which they are typically found. And then with your exogenous anaerobes, these are pathogenic anaerobes that are usually found within the soil and the water. And examples of this would be Clostridium botulinum and Clostridium tetani. Most anaerobes gain entry into a sterile body site as a result of a disruption in some sort of anatomic barrier, so like a break in the skin or some sort of trauma. And most of them have person-to-person spread that will cause the organisms to spread from individual to individual. And here is a small flowchart for gram-negative organisms. You can see that once you have set up a culture for a gram-negative culture environment, so typically in some sort of anaerobic gas chamber or some sort of anaerobic bag or anaerobic type incubator. Once you've set up those anaerobes and you're looking at those plates, then you are determining if there's growth. So if you do have growth in an anaerobic environment, you'd want to do a gram stain to determine what its gram stain characteristics are, whether it's bacilli or cocci, gram positive or gram negative. And then depending on that, let's just say we have a gram positive bacilli, and from there, once we look at that under the microscope, we are looking to see, does it form spores? And of course there were some aerobic organisms that do form spores, so you would differentiate those two on whether it grows aerobic or anaerobic. So a spore former in our anaerobic environment would indicate some sort of Clostridium. And a non-spore former of gram-positive bacilli would indicate one of these other organisms. And of course we have gram-positive cocci, and then we have gram-negative cocci, as well as gram-negative bacilli. Here we have our list of organisms that we will cover. This will include our gram-positive bacilli, which will be broken into spore formers and non-spore formers, a gram-negative bacilli, gram-positive cocci, and gram-negative cocci. Our gram-positive bacilli that are spore-forming include our Clostridium perfringens, Clostridium botulinum, Clostridium difficile, and Clostridium tetani. These organisms are all gram-positive, obligate anaerobes. They are all catalase negative. And of course, they do have an endospore. And so those spores can also, because they're spore forming, can also produce a variety of potential toxins, which can cause serious complications with these infections. And there are also some shock spore tests that can be performed to help you determine if the organism is a spore former, because some of these organisms may not demonstrate those spores as predominantly as expected. But you can see here in this image where you see one little spore inside of this bacilli, but most of the others do not have any spores, or they're very difficult to see. So that shock spore test may be something that would need to be done. It's not very common for this test to be performed in a regular routine lab, so it's not a test that you need to be familiar with. Clostridium perfringens is part of the normal intestinal flora. That's also found universally throughout the environment in the soil. The infections that it causes is commonly known as gas gangrene, and this is when a wound becomes contaminated. And then from there, it can produce a redness and swelling around the wound that can progress to a greenish-black discolorations. And as it progresses, there's toxins that are released, and these toxins will actually start to destroy the tissue in the muscle. And then it will also produce gas that you can see an example here at this top image, where a gas bubble has formed under the skin. It can be fatal within about 48 hours without any sort of antibiotic treatment. However, the wounds are typically going to have some sort of like surgical debridement. The patient will be treated with antibiotics, and the patient could also be treated with a hyperbaric O2 chamber. These organisms can also produce, can cause a type of food poisoning from the toxins that it produces, and this is known as neutropenic enterocolitis. With identification of this organism, it's going to typically be identified based on its appearance as it grows on the blood agar in an anaerobic environment. So if you have an anaerobic culture plate that demonstrates a double zone of beta hemolysis around the organism, you can see that here at the bottom, where this particular organism has a zone type effect. So you can see little waves in the hemolysis of the plate. So you have around the organism itself, it is, so you have the organism here in the center, and then around it you have that clearing, that beta hemolysis, and then as it goes out you can see kind of like waves or zones of the hemolysis where it's not completely destroyed those red cells. So based on this characteristic, as well as the appearance on a gram stain, you do see those spores on the gram stain. There's several here, so you can see here where this one, it looks like it might be gram negative. However, because those spores do not stain, you can only see the stain of the actual organism, not the spore. So it kind of gives it a mixed variable type look. But they also have a boxcar type shape, so they're kind of squared off. They look kind of short and plump. And they're also catalase negative. Clostridium botulinum is found throughout the soil. And so these organisms, because they do produce endospores, those endospores can become airborne and contaminate various food sources. And then those spores can later germinate, and then that will produce a lethal toxin, and this will result in botulism. So with botulism, these infections happen as a result of the botulism neurotoxin that is produced from this organism. And so this organism can be ingested, or it can infect wounds, colonize the gastrointestinal tract, This is more common in infants with the infant botulism. And so what this particular organism will do once it causes the infection is when it releases those neurotoxins, then it will cause paralysis of the respiratory tract as well as various muscle groups. And here you can see an image of an infant who has the infant botulism, and they have those weakened neck muscles. And so the infants are at greater risk if they were to ingest honey that contained those spores and produce those toxins. So this organism with botulism can create blurred vision, dizziness, muscle weakness, as well as a paralysis. And so this is one of the reasons why it's very important when canning foods and storing foods that they are heated when they're prepared, because any sort of boiling effect with that heating destroys the particular toxin. So when canning food, it's very important to reach those temperatures where it seals that food off. To identify this organism, you can look for the toxin that's produced in the serum, feces, gastral contents. With this organism, it's usually going to be isolated from the stool in culture. They are gram-positive bacilli with those endospores, and you can see this image here up top where these organisms have those endospores. They are subterminal, so they're right at the end. However, you can usually see a little bit of a tip where it's not fully terminal. This one right here is a good example of that, where you can see that tip of that bacilli beside the spore. So if you were to do a stool culture with an anaerobic incubation, and this was suspected, then that's one of the things that would help you to identify would be the location of that spore on that gram stain, as well as the appearance on agar. And you can see that this organism is not beta hemolytic like the previous. Clostridium difficile, which is more commonly referred to as C. diff, is found in the soil, air, water, human and animal feces. And this infection usually takes place after there's been a use of a broad spectrum antibiotic, which will lower the normal flora, and it allows the C. diff to actually start to colonize and proliferate the large intestines. And it produces enterotoxins A and B that will cause a pseudomembranous colitis, where it actually destroys the intestinal lining. And so patients can present with watery diarrhea, abdominal cramps, fever, bloody stools, nausea, dehydration, and it does have a very distinct odor to C. diff. So once you encounter it in a clinical setting, you'll be very familiar with what C. diff smells like. So to diagnose C. diff, there are a number of things that can be done. Of course, a colonoscopy, looking for those characteristic lesions within the intestines. Stool immunoassays can be performed looking for those toxins. If this organism was to grow on a plate, it does have a very distinct horse stable smell to it. So the technician can tell pretty quick once opening that plate that they are dealing with a C. diff. And it does have a little bit of a different appearance to it when it is growing on that plate. It's kind of got a spready type look to it. And then if they were to do a gram stain, of course they're looking for those gram-positive bacilli, which do have those spores within those bacilli. And if they were to do any sort of sporulation tests, they would see those spores, or if they would do a spore stain, they could see those spores subterminal. And then one of the other things that can be done would be to plate it on a CCFA agar. And so if they were to plate this on the CCFA agar, then what they're looking for is the production of those yellow colonies. So that would help kind of confirm that it is C. diff. Clostridium tetani is found within the soil, And what will happen with this is there will be some sort of puncture wound or open wound in which these endospores will contaminate and start to grow anaerobically. And then from there it will produce a toxin that actually causes tetanus. And so the toxin will actually bind the different target nerve cells, and then it will actually inhibit the interneurons that regulate the muscle contractions, and these will actually be blocked, which will cause muscle spasms, and which is more commonly known as lockjaw, and then it will lead to exhaustion and respiratory failure within the patient. And this is said to be a very painful and very rapidly fatal disease, which it affects when it affects those nerve cells like that. And so this is why the invention was made for the vaccination to help prevent tetanus. These organisms are also gram-positive anaerobic bacilli that do produce spores, and you can see here up top where you have those terminal spores on this organism. And typically this organism is going to be recognized for the disease state, not necessarily for culture, but it could be cultured if needed. And so those characteristics will be covered next. So PCR is available for Clostridium perfringens, and you have different immunoassay techniques to help identify C. difficile, where it's looking for those enterotoxins. And there's also the NAT testing that's available as well to help look for the C. diff toxins. And then you have the mouse bioassay that will help look for the botulinum toxin. And then as far as comparing these organisms, there are various types of the botulism, the Clostridium botulinum, and so those can have some variations to their biochemical testing. But here's a chart to kind of explain the differences in the biochemical testing within these organisms. And so they can somewhat be identified with a preliminary identification just based on their anaerobic growth and appearance on the blood augurs. But to get a definitive identification, then this biochemical testing would need to be performed. Here's a nice little chart that breaks down these organisms to kind of help you understand where they're found, how the infection starts, and the different toxins that are produced and the disease infectious state that it produces from that infection and those toxins, and also how it can be treated. Gram-positive bacilli that are non-spore forming, we can divide those up into catalase negative and catalase positive organisms. These organisms are normal flora of mucosal surfaces, and they're usually identified with polymicrobiotic infections. So these would be infections where you have multiple organisms. So if you're working up an anaerobic culture, then you could potentially see these organisms as well as the particular pathogen that you're looking for. So it would be multiple organisms in one culture. And the testing that would be performed on these, if you were to do the antibiotic sensitivity testing that you do to work up some of these anaerobic organisms, these particular organisms would all be resistant to the colistine, susceptible to vancomycin, and they would have varying reactions to the kanamycin. So our first gram-positive bacilli that is non-spore forming, that is catalase negative, that we're going to discuss is Acanthamyces. These organisms are common flora of the human mouth, and they can cause various infections, including bacterial vaginosis, and this can be associated with use of IUDs. Cervical facial infections, also known as lumpy jaw, And this is a slowly developing abscess of the neck and face. It's sometimes associated with some sort of dental surgery or facial trauma. Pulmonary infections can happen as a result of aspiration of the mouth flora to the lower respiratory tract. And then from there can be some sort of like abscess that can form. Abdominal infections after ingestion of the organism, and then it can develop GI lesions that can rupture and cause further complications. And so this organism itself is very slow growing. It's difficult to cultivate, but it is a gram-positive bacilli that cause a branching, beading type appearance. And you can see here where this organism looks like several branches just kind of coming off of each other, or a root type appearance. They do have a molar tooth type appearance when they're growing on the auger. So you can see here where these look like teeth. The culture's colonies itself looks kind of like a little tooth of some sort. And they also cause sulfur granules in various fluids. So it could be from an abscess, as well as if there was a pulmonary infection and the secretions and fluids from the pulmonary tract were coughed up, then you could actually see these little granules. And here's an image here. You can see that yellowish looking granule, sulfur granule, from what looks like probably some sort of abscess. And you can see that lumpy jaw of this patient here. And again, these organisms are catalase negative. Lactobacillus is widely distributed environmentally in foods and nature. And this organism is the normal human flora as well. And so it's typically found in the mouth, GI tract, and the female genitalia tract. It is very important to maintain the proper pH within vaginal secretions to make sure that that you have more of this organism and not something that can cause bacterial vaginosis like the Gardnerella. So with this organism, if you've ever looked on any of your probiotics, Lactobacillus is one of the several organisms that are within those probiotics. So most frequently, it's just encountered as a contaminant. However, it can cause issues within those who are immunocompromised, and so it can actually cause dental cavities as well as endocarditis and bacteremia. To identify this organism, it is a gram-positive bacilli that forms long chains with no spores. So you can see a chaining type reaction in this gram stain. If a patient, if you were to do a wet melt on a patient, you can often see the lactobacilli in that wet melt in long chains. It is H2S negative. It'll grow on sheep blood agar as well as chocolate, and no growth on McConkey, catalase negative. Propionibacterium acnes is most commonly the common resident of the hair follicles of the human skin. And this organism is the cause of acne vulgaris, or pimples. It releases a lipase that digests the skin oil, producing fatty acids. And this, along with the bacterial antigens, stimulate local inflammation, and it will actually burst the hair follicles. And then it will produce propionic acid from glucose usage, and is implicated in other infections like corneal ulcers, heart valves, prosthetic devices, central nervous system, and different opportunistic mixed infections. And so you can see an image here of where this infection has caused a severe case of acne on this individual. These organisms are slow-growing and non-spore-forming gram-positive bacilli. They are hemolytic on sheep blood agar. And these organisms are actually catalase positive and indole positive. And so you can see the gram-positive bacilli here in this lower image. Bifidobacterium are normal microbiota on the mucosal surfaces of the digestive and urogenital tract, and they're also found on the skin. These infections are not very common. You usually don't find these organisms in clinical specimens. However, if you do, it's usually encountered in a mixed infection from a specimen from somewhere in the pelvis or the abdomen. And so these organisms are strict aerobic, but they can also be microaerophilic. They are gram-positive dipteroid type organisms. They can appear as coccoid, thin, they can have pointed shapes. They can be large, irregular, curved, or branching, so they can take on a variety of shapes. The rods will tend to terminate in some sort of like club or a thicker type end, and so you can see that here in this gram stain where some of these look like they get kind of big on the ends here. So they kind of just fatten up or plump up right there on the ends, kind of give it a little club shape. You can also have some that have a forked or splintered type end to it that kind of make it resemble something similar to like a little dog bone. Some of these don't have a very good appearance of that, but you can see how they kind of fatten up towards the ends of them. And so you can see where it would give that dog bone shape to it. So these are known as pleomorphic type rods. And so when you culture this on an anaerobic blood agar in anaerobic conditions, you would see small, white, convex, shiny, and irregular shaped edges. You can see a little bit in this image here where they're just kind of, the edges are kind of flattened or on the side of this particular colony where there's nothing beaten up against it. They are sensitive to vancomycin, kanamycin, and resistant to cysteine. The spot indole can be variable, catalase negative, and nitrate reduction negative. Urobacterium is also normal microbiota of mucosal surfaces of the digestive tract and urogenital tract. These infections can occur as oral infections. It's usually associated with some sort of mixed infection in the oral cavity, abdominal, pelvis, or urogenital tract. These are gram-positive pleomorphic rods or coccobacilli, and you can find them in pairs or short chains. Of course, you have one species that will look similar to the seagull wing shape that's similar to Campylobacter. And then you have another species that is similar to Acanthamyces, where it'll have that beading type form where it has little filaments and it appears to be branching. So you can see some of these patterns here in this gram stain image where you have that seagull wing shape, as well as a lot of the branching. And you can see how they're kind of forming little chains and things like that. So in anaerobic blood agar culture, it would appear as small, gray, transparent, translucent, raised convex colonies with a BKC of sensitive resistance, and a spot indole is variable, catalase negative, nitrate reduction negative. To identify these organisms, they can be differentiated based on their gram stain and colony morphology characteristics. Air tolerance testing could be performed for these organisms because some of them may grow in an air tolerant environment or environment that's richer in O2, but it may take them a little bit longer. Rapid testing could be done. An example would be 15% catalase testing, indole and nitrate reduction testing. And then there are also some different automated methods out there that can identify these organisms. Your gram-negative bacilli include those that will grow on the BBE agar, which is your Bacteroides balaesculin agar. And your Bacteroides fragilis will actually grow on this agar and produce a black halo with that bile esculin. And then you have the others that will either grow very, very poorly, or they will not grow at all on the BBE agar. Bacteroides fragilis is normal flora of the human colon. And so what this organism can do is actually cause infections if the normal mucosa of the GI tract is breached in some way. Then it can actually cause this infection to spread throughout the abdominal cavity. And so you would have things like intra-abdominal abscesses or peritonitis. And so this can happen sometimes after something like some sort of spillage from the intestines. So there's some sort of rupture of the appendix, or some sort of penetrating wound from the intestinal lining, or a complication of surgery. Then those contents could spill out and actually cause the infection. And then from there, it can also spread to any area of the body, including the bloodstream. And these organisms actually have villi, which allow it to attach. It has capsules, which can help it to prevent from being phagocytized by the normal white blood cells. And it can also produce beta-lactamase. So with identifying these organisms, you're looking for an anaerobic growth or an anaerobic culture media. It is non-motile, gram-negative bacilli, and it will grow on the BBE agar. And when it grows on the BBE agar, which is the Bacteroides bile esculin agar, you are looking for the blackening around the colonies where it utilizes the bile esculin. These organisms are catalase positive, and organisms being catalase positive is very unusual for most of your anaerobes, so that does help to differentiate this. And then you also have your antibiotic testing that's done with the different discs. So you have your vancomycin, your kanamycin, and your colistin. And so these organisms are resistant to all of these antibiotics. So you can see where there is growth of the organism all the way up to the disc. So they are resistant. Fusobacterium is typically found in the oral cavity, and it can be found within the biofilms in the oral cavity or on the teeth. It causes infections of the upper respiratory tract, to include things like your sinuses, aspiration pneumonia, pharyngitis, lung abscesses. And then some of the diseases, some species of this organism can cause periodontal disease. Identification is based on its anaerobic growth with spindle-shaped gram-negative bacilli. So you can see here in this gram stain where these organisms have more of a spindle shape, or they have those pointed ends like it would be with a spindle of thread. These organisms do fluoresce under UV light with a chartreuse appearance, so you have that lime green fluorescence there on that agar plate under a UV light. And if they're growing on the media, they can have like a breadcrumb-like appearance to blood agar. You can see here where this looks kind of like a little crumb. They're indole positive, catalase negative, and these organisms are resistant to vancomycin. As you can see here in this bottom image, the organism does grow all the way around the vancomycin, but they are sensitive to the kanamycin and the colistin. Porphyromonas species are found within the oral cavity and GI tract. They can infect the head, neck, pleural pulmonary infections, and can also cause a periodontal disease. One species of this organism has been implemented in gingivitis. The identification of this organism is based on its growth as an anaerobic organism with gram-negative bacilli. And it does have a bit of a pigment to it when it grows on agar, so you can see here in this culture up top, where you can see some of those organisms do have a pigment to them. And this organism under a UV light will fluoresce a brick red or a brown to black pigment to it. You can see an example here at the bottom where it has that reddish look to it. And their VKC susceptibility is susceptible to vancomycin, resistant to the other two, catalase negative, indole positive. Prevotella is found in the respiratory, oral cavity, and GI tract, causes lung and dental infections, and is associated with periodontitis. These organisms are non-motile gram-negative bacilli, and these organisms under UV light will also fluoresce a brick red, brown to black pigment. You can see an example up top. They're catalase negative, indole positive, and VKC susceptibility is resistant, and variable with the cholesterol. And you can see this plate here at the bottom where this organism does have a pigment when it grows, as well as it does not grow on the BBE agar. Here's a chart to help differentiate these organisms with your anaerobic gram-negative bacilli, and it's based on their growth on the BBE agar, as well as how it responds to the different antibiotics, catalase, and nitrate. The last organisms we're going to discuss is going to be our anaerobic cocci. And so this can be divided into gram-positive and gram-negative. Now again, there are other organisms that are anaerobic that we've not covered, but these are the ones that we're going to see most often in our clinical setting. So our gram-positive anaerobic cocci includes the Peptostreptococcus anaerobes. And so this is normal flora of the oral cavity, upper respiratory tract, and GI tracts. These infections are most often isolated from polymicrobic infections, which are infections that have multiple organisms, and so this is usually something like an abscess. With identification, we're looking for growth on an anaerobic blood agar plate with medium, greater white, opaque colonies. They can have a sweet or a putrid odor, or a sweet putrid type odor. The colonies are usually very large, or larger than most of the other anaerobic cocci. If we were to look at it on gram stain, we'd see large coccobacilli that form chains with a VKC of sensitive, resistant, catalase negative, spot indole negative, nitrate negative, and SPS susceptible. Vionella species are gram-negative anaerobic cocci. These are normal flora of the oral cavity, respiratory tract, genitourinary tract, and our GI tract. These infections involved mixed infections that are usually isolated. They have been isolated in increasingly serious infections, including meningitis, osteomyelitis, endocarditis, bacteremia, and different prosthetic infections. We would identify this organism growing on an anaerobic blood agar plate with small, almost transparent grayish-white colonies that are smooth, entire, opaque, and these colonies can also have a red fluorescence to them if you were to use a UV light at 360 nanometers. On gram stain, they have tiny diplococci that are in clusters, pairs, and short teams, and they are typically resistant to vancomycin. And here we have some images of those gram-positive cocci, and you can see the stain here where you have some of these that look a little bit pinker than they do that purple color. And you also here at the bottom you see your susceptibility with your VKC as well as your SSP that is sensitive. And then our Vionella, we have those very tiny gram-negative cocci. And you can almost only see these simply because they're grouped together in these large groups. Some of the ones that are off to themselves, you can kind of see they're more in little pairs. And so they're kind of really hard to tell the shape of that bacteria because they are so small.